wellness revolution starts now.
Hello, I'm Dr. Steve Hotze. Welcome to the program today. For those of you that have young girls that have just entered puberty and are in their teenage years, you know that sometimes this development in their life, when the hormones start to change, they begin to have menstrual periods, it can cause some symptoms. It can cause mood swings, cause fluid retention, it can cause weight gain, it can cause breast tenderness, they can get headaches, they can get irregular periods, sometimes light, sometimes heavy. And oftentimes, these young girls are taken to an OB-GYN. He'll say, well, I'll solve the problem. We'll just put them on birth control pills, which doesn't address the underlying problem. The reason some young girls and women as they get older, have problems premenstrually with the premenstrual symptoms is because they have an imbalance in the two hormone groups, progesterone and estrogen. Now, in a perfect world, in a 28-day cycle, a woman will, when her bleeding starts, that's called day one of her cycle. And it goes all the way through until she has her next period. And that routinely, on an average, is 28 days. Now, that varies from women to women, but that would say an average. And so what happens is that her ovaries begin to make estrogen hormones. After the ovaries have quit making hormones, estrogen and progesterone, that causes the sloughing of the inner lining of the womb, and then they begin to make estrogen hormones, which builds up the inner lining of the womb. And then there will be a day on which a woman ovulates in her ovaries, and she gives off an egg, and then she begins to make progesterone, and that progesterone matures the inner lining of the womb, preparing for a pregnancy. If there's no pregnancy, then all the hormones fall. Woman sloughs the inner lining of the womb, has her menstrual period, and then the whole thing starts over again. But what can happen is that if for any reason, and there's a lot of reasons that women can have imbalance in their hormones, especially when they're younger, one thing is that we are exposed to a tremendous amount of toxins in the air we breathe, in the water we drink, in the soda water, and all these sort of drinks that people have, from all the chemicals in the various packaged foods and canned foods we have. And these foods contain xenoestrogens, which are counterfeit hormones that adversely affect the ovaries' production of hormones in young girls. And so they get imbalances. So that's why it's important really to clean up your and your teenagers' eating habits so that you're eating whole foods and you're not eating a bunch of processed foods. You're not eating out of McDonald's all the time. You're not eating out of packages or boxes, because the chemicals in those various foods, look on the side of a package. If you have corn chips, you'll look in there and there'll be 15 or 20 different items that they put in that food, all kinds of additives, most of which are not natural or normal and can cause adverse problems in a person's hormonal system. So what we recommend, first, clean up your eating habits. Get on whole organic food as much as possible and eat as much as possible homegrown meals. I like to say, if it's in a package, a box, or a can, don't eat it. Eat whole foods. And second, for young girls, when they have these menstrual irregularities, it's usually due to low levels of progesterone the last half of the month. And this can happen as women get older too. As they get older, they make less progesterone. They become progesterone deficient and estrogen dominant. And that can cause the mood swings, the fluid retention, the headache, the breast tenderness, migraines, heavier periods. And so what we do is we replenish the progesterone day 15 through 28, and that routinely will level out all the mood swings, and level out the periods, cut out on the heavy cramping and that women oftentimes develop when they have irregular when they have imbalance in their hormones and they have irregular periods, they get that severe cramping and they get the breast tenderness. And progesterone can be a godsend. And that's given based upon a woman's age, her size, and her symptoms. So young girls, we just need to give a little bit of progesterone day 15 through 28. As a woman matures, you oftentimes need to give more. But progesterone can be a godsend for you personally if you're having menstrual irregularities, and it can sure be helpful for your young women that have entered puberty and are in their teenage years. So if you want to know and gain some more information about that, then please feel free to contact one of our new guest consultants here at the Hotze Health and Wellness Center. We'd be glad to partner with you and get you on a path of health and wellness, and your daughter's on a path of health and wellness naturally.
At Physicians Preference Pharmacy, we believe that prescription drugs are commonly overprescribed, treating symptoms only rather than addressing the underlying condition. These drugs offer a temporary fix, but they don't solve the root cause of the problem. Our approach is not about overloading people with medications that offer only a temporary fix. It is so important to recognize that you do not get sick because you have a low level of pharmaceutical drugs in your blood. You get sick because you are deficient in something or because your body is not in balance. As part of your healthcare team, we work with your doctor to restore that healthy balance. Sometimes this means replacing hormones, vitamins, nutrients, or even antioxidants. So how is this different than traditional treatment? Rather than covering up the symptoms with yet another medication, we work to replenish the body, restoring your health and restoring your wellness.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.